A very good afternoon to all the members who have joined us on live for the Artificial Intelligence, Robotics and Nursing chapter. At the outset, we realize that registered nurses and nursing practitioners are accustomed to emerging technology impacting their environments and daily duties. While these advances in technology and equipment bring many positive changes, there are some trends like robotics which are feared because of the possibility that they might take away jobs from nursing. However, the opportunities for nurses and robots to work together and the innate skills and characteristics of humans, it makes our registered nurses and NPs absolutely irreplaceable. So, at this point, I want to invite Mrs. Leena Chandrasekharan, who's our head nursing operations, working for Mehta Multispecialty Hospitals, to give the welcome address. Ms. Leena is a qualified MSc nursing professional who's our ANEI state secretary. With 4 quality improvement project leads, she has been part of the 5S project. She has taken lead membership in the EY project, and lots of other things to her credit. So over to Leena to do the welcome address.
Thank you, Ms. Joy.
Leena, can you unmute?
The core of what makes us human is paying attention, being empathetic and caring, which can never be replaced by technology. However, innovations can relieve nurses of the burden of many monotonous and repetitive tasks. Let us see how technology and artificial intelligence supports the future of healthcare systems and nursing. Ladies and
हाँ पेशेंट को शिफ्ट किया है बाहर जो गार्ड है ना वो आपको बता देंगे जो मिलने के लिए वो अंदर चला करेंगे
Excuse me, Priyanka, can you please mute yourself? Priyanka, please mute yourself. You are disturbing the proceedings. Thank you. Leena, please continue. Leena, are you there? Jyoti, I think we have. Leena, continue, please. Yeah.
Yes. Ladies and gentlemen, a warm good evening. It's a privilege for me to welcome each of you on behalf of ANEI chapter, ANEI Tamil Nadu chapter, for the webinar on artificial intelligence, robotics and nursing. I welcome the speakers for the day, Dr. Shivashankaran, Ms. Saraswati and Mr. Samir Mehta. I welcome the chief guest, Ms. Elaine. I welcome Ms. Thankam Gomez, the National President, ANEI, and Dr. Jyoti Clara, the National Vice President of ANEI. I welcome all the EC members who have joined us, both the national and at the state level. I welcome all the participants, nurse leaders, and bedside nurses who have joined us. A brief introduction about the Association of Nurse Executives. It was launched under the support of AHPI in 2017, February, though the initial thoughts were from 2011. The MOU was signed in March 2017, and the first EC meeting was held in April 2017. And the Tamil Nadu chapter began its activity in April 2017. ANEI was registered in 2018 December, and the office bearers are Ms. Thankam, the President, Dr. Jyoti Clara, the Vice President, Ms. Shubhada, the Secretary, and Ms. Ajita, the Treasurer. And we have 15 founder members, 12 EC members, and 14 chapter heads. And we have lifetime membership, associate membership, institutional membership. So if any of you are interested to enroll as members, do contact any of the office bearers or the chapter heads. So this is a brief about ANEI, and I'm sure you will all enjoy this webinar. We have experts. You could spend time asking questions. They are there to answer anything related to artificial intelligence, robotics, and nursing. Thank you.
Thank you, Leena. We will now move on to the presidential address by Tangam ma'am, who is our founder and CEO of the Signia Healthcare. Madam is also the ANEI president. A few words about Tangam Gomez ma'am is that she has been the head of education at Berkeley Health EDU and worked with medical and nursing colleges to collaborate and include simulation-based learning during the formative years for doctors and nurses. Ma'am is also the co-chair of the Task Force for Nursing Reforms of FICCI and member of National Health Care Committee, and is frequently invited to special groups formed by the government and other bodies as a subject matter expert. She is the founder member of Infusion Nurses Society India, associate member of Indian Society for Critical Care Medicine, and member of American Organization of Nurse Executives. She is the founder member and president of recently formed Association of Nurse Executives, ANEI, India, under the aegis of Association of Healthcare Providers for India, which is AHPI. She has undergone special training in simulation and debriefing from Jurong Health, Singapore, and further honed her skills to be a trainer under the Dale Carnegie's Triple T program. She's a certified Lean Six Sigma Green Belt and a graduate of UCOL New Zealand. Ma'am, you with us, and I request you to give the presidential address.
Thank you, Joy. Thank you very much. Good afternoon, everyone, and thank you so much. It is so encouraging to see 100 and almost 180 participants here, and very excited for this particular webinar. If someone asked me last year whether we are going to talk about robotics and artificial intelligence nursing webinar, I would have told maybe no, maybe yes, robotics, but not AI for sure. So I think this is one of the upside of Corona, COVID-19. We all have become so connected, and we are having lots of webinars, right, left, center. We have lots of webinars. So Association of Nurse Executives India, we stand for empowerment of nurses. And the leaders have come together to ensure that we use our collective strength to ensure that we do something good for nurses. So this particular topic is also initiated by Tamil Nadu chapter, and I'm very happy to, say all the best to this particular webinar. The chapter head at the moment is Dr. Jyoti, the Vice President of ANEI, and Leena Chandrasekhar is the Secretary for the chapter. And Tamil Nadu chapter always had been a forerunner when it comes to chapter activities, and so I'm very happy that it is happening today. And I would just want to talk a little bit about artificial intelligence. So I have a certain understanding, and my son is software engineer, so I called him. I asked him that how will you define artificial intelligence in a simple layman's language? So he said, the term artificial does not mean that somebody is going to create that artificial intelligence from somewhere. So he told a very simple analogy. That he said was that, Mama, it is like bringing up a kid, training the kid that what is good and what is not right. So it's exactly that. It is actually training the computer to with all the data that is going to go inside. As simple as that. And I'm sure that with all the current development, can I request everyone to mute yourself? This is first thing that, when you attend the webinar, to learn that please mute yourself so that you do not disturb the proceedings. And we have got very eminent speakers who are going to share their experience and their knowledge with us so that we understand that where are we going from here, 2020, what is it that we're looking forward. And we should go away from here, not that one more webinar. We should have some takeaway from here, what is in stock for us in the future. So AI is about actually telling the computer what it has to now decide. So when we have huge data, we can actually predict a lot of things for our healthcare, and that becomes very useful. And I think I can envision nurses, if their data also get into that EHR, the AI can now even predict that if you have a certain patient, it can not only predict the clinical outcome, it can also help us to say what kind of a nurse plan needs to go into the patient. I mean, I'm just thinking of very, very basic things that can happen because of AI. And then robotic surgery. So now robotic surgery, a little bit I discussed with few people to understand what do they understand. So they have a feeling that robotic surgery means the robot is doing the surgery, and the surgeon and nurses, they don't have much of work. The surgeon is more like managing the robot. So today we are going to hear from people, Dr. Shiva, who is actually a robotic surgeon, and Saraswati, who is a robotics surgery nurse. They're going to share with us their own experience. So my request is that please be here and stay muted. And if you have questions, you can put it in the chat box. Let's have a great time of learning from. And Mr. Sam Mehta is going to come and tell us about AI. So I'm looking forward to all the deliberations, and thank you so much for the Tamil Nadu chapter for taking this initiative. Wishing all the very best to the webinar. I'm still around. If I have questions, I will also ask few questions. Yeah. Thank you so much. And I can see we have some EC members here. Our secretary is already here. So I'm leaving that to Dr. Jyoti to acknowledge them as a TN chapter head. Thank you so much for making this event happen. And I'm sure that it's going to rock. And thank you very much once again to Leena, Dr. Jyoti, and all the members of Tamil Nadu chapter, and all the very best for this conference. Thanks, Joy. Please carry forward.
Thank you so much, ma'am. Even when we were circulating this little pamphlet across to all the, nursing groups, non-nursing groups, the first question was artificial intelligence and nursing. So, that little vibe, I think, has left when this pamphlet was out. And so it is definitely a beautiful forum to be connected with. And we all have lots to learn here. So now it's my great Elaine. So Elaine NG, our group nursing, head of nursing for HH Berhad. She has come with a work experience of more than 30 years of nursing experience, manages nursing for Singapore, Malaysia, India, Hong Kong, Brunei, China, and Turkey under the IHH Healthcare Berhad. She mentors the directors of nursing and guides them in their roles to achieve high nursing standards and quality patient care. Sat in the Singapore Medical Council Discipline Committee and Singapore Nursing Board Education and Clinical Accreditation Committee. She's an adjunct associate professor. Achievements include from 2010, she has been referred by the Women Weekly magazine, Great Women of Our Times. 2007, President's Nurse Award, Nurse National Efficiency Award. 2009, second prize in the ASM Scientific Nursing Award, and 2006 Healthcare Humanity Award. Academic qualification spans from her post-basic in critical care, post-graduation in higher education, Bachelor of Health Science, Master in Nursing, Acute Care, and Master of Business Administration. So ma'am, we're very happy to have you with us as our chief guest. And definitely, I'm sure you've come with your worth of experience here to share with us. I now invite you to give the chief guest address.
Can you allow me to start my video? I cannot start my video because the host has stopped it.
Please come on video.
Jyoti, can you stop sharing the presentation, please? Jyoti, please stop sharing.
I cannot start the video.
Elaine?
Elaine, please come on screen.
I can't start the video because the host has stopped it.
I have not done anything.
Oh, I tried to on, okay, the message is saying that the host, okay, let me show you what is. Let me see the video again.
I'm not able to see your name also.
Yeah, I don't know why, but I don't know why I can't. My name is there, but I can't on the video.
Just give me a minute. Let me check.
Yeah.
I'm not able. Okay, just a second. Let me see. I'm going to ask you again to start video. Maybe that should work.
Oh, yes, yes.
Yes.
Okay, yes, thank you so much. Thank you, Joyce, for the kind introduction. A very good afternoon to all distinguished speakers, fellow nursing leaders, nurses, and guests. It is my pleasure to join you as your chief guest for the ANEI Tamil Nadu chapter webinar on artificial intelligence, robotics, and nursing. Allow me to briefly share with you on my organization, IHH Healthcare. It is the largest healthcare group, comprises of 77 hospitals in 10 countries such as Singapore, Malaysia, Hong Kong, China, Brunei, Turkey, and India. For those countries that we have 3 hospitals or more, we have a country director of nursing. And in India, we have Daniga Global and Continental Hospital, which is headed by Dr. Clara Jody. So the director of nursing in the country are empowered to have the leadership oversight of all the nurses in their hospital. In IHH, we have 55,000 staff, and out of the 55,000 staff, 22,000 are actually nurses. COVID has disrupted our life, but it has also created new opportunity for us. Today, we are connected through technology to showcase how our nurses and doctors embrace AI and robot in upholding patient safety through excellent nursing and medical care. Nurses are known to be creative and innovative, especially in challenging time and situation. True nurses displays professionalism, commitment in lifelong learning, and courage to speak up for our profession and patient. The Association of Nurse Executive India is one of such associations where we see nursing leaders from various organizations, namely military, corporate, private, missions, and trust hospital, small or big, coming together with the aim of bringing nursing to greater height. It is my honor to get acquainted with the president, Miss Tangam Gomez, a visionary and nurturing leader. I met her a few years ago in other conference. And with her is Dr. Jody Claras, Vice President of the associations and a head of Tamil Nadu chapter. Clara is also our country don, as I mentioned earlier, for India. Clara is respectable and dynamic leader who believe in grooming the next generations of leaders. As you can see, Miss Lina, the up-and-coming leader under her mentorship. Healthcare has evolved over the years from nursing educations to healthcare delivery models. And technology has moved very rapidly. In the recent year, we heard about genetic and genomic. We hear about less invasive and more accurate tool for diagnosis and treatment. We see the 3D printing, robotic, biometric, electronic healthcare record, computerized ordering system, and also clinical decision support. Now, today, the focus is on artificial intelligence, robotic, and nursing. We identify emerging trends that are changing the way we practice medicine and nursing. The idea of robot taking over our job is nothing new, and AI has become more advanced, and more tasks can be automated. Example, in IHH, we have hospitals which use AI for billing accuracy and also predicting deteriorating patient in the ICU. Have you heard about public relation robot? Have you seen car that without driver? These are all the in things now. When I was the project director for the COVID community care facility in Singapore, we used robot and with artificial intelligence to serve food to the resident, also to clean the environment. Using robot in such situation is to avoid potential spreading of the virus during outbreak of infectious disease. Like Ms. Tangan Gomez had mentioned earlier, in the OT, we use robotic surgery as it is less invasive and it gives more comfortable experience for the patients because of its ability to do smaller and more precise interventions. The clinical outcome is also much better. In addition, robot can also be used as adjunct care provider for some physical and mental health care provision. The growth in robot is expected due to workforce shortage, a growing elder population, and a call for higher quality care, not subjected to human limitations. Robots can also help in the mundane, repetitive jobs. And one thing good about robot, they will never complain. It is also important to know that in all technology, the human brain behind it is very important. We know the saying of garbage in, garbage out. Therefore, we need to use data to help us in our decision making. More research is also needed for comparative effectiveness of robotic and human care provider. We have to compare the robot and our humans. It is also important to emphasize that robot will never replace nursing professional and that humanized care that we provide as a nurse. Robot can only assist us in our professional practice and repetitive tasks. Just like our monitoring machine in the ICU, it tells us the parameter of the patients. But we still need the nurses to do the assessment. I remember many years ago when I was working in ICU, the ECG monitor showed a straight line. So does that mean the patient is dead? No. The answer is the nurses have to go to the bedside to assess the patient. As long as the patient is still breathing and talking, the machine, we just have to troubleshoot. Maybe the lead is off. So this is what we have to do as a nurse. Nurses' clinical judgment and competency cannot be compromised. And the passion and the empathy that we have cannot be replaced by robot. As nurses, we must continue to uphold our professionalism and be proud of our service to mankind. To the ANEI Executive Committee member, I encourage you to continue leading nurses in India to the international level. I envisage the potential contributions of Indian nurses, both locally in India and internationally. In India, according to the statistic in 2020 March, you have 3.07 million of nurses. You can have great impact to the world as mobility of nurses has grown significantly in the recent decades in response to globalization and supply-demand dynamic. Today, I'm also very happy to see so many familiar faces. I look at the presidents, I look at the vice presidents, I saw Joyce, I saw Lina, who are our ed staff. I always say this, it's okay that you're not working in a hospital, but you must continue to remain in the profession. You see, going outside to gain more experience, it will add value if you return back to us. And I'm glad to see Mr. Sam Mata, whom I met a few years ago in another conference. And Sarawati, my nurse from India, who came all the way from India to work in Singapore for 17 years. And today, she's sharing in this conference. So technology has brought us closer, has brought us nearer. Lastly, I would like to congratulate the organizing committee for having such a webinar. And I wish all of you, 180 of you here, have a fruitful event. Take this opportunity to learn, to share, and to grow. With this, I wish all of you a good time. Thank you.
Thank you, Elaine. Thank you so much. Definitely, we will uphold the cause of nursing, and wherever we are in the planet, I think we will always be connected together as a team, like the values that I saw on your screen behind you. So I think definitely we will uphold all of the values that you have told us just now. So moving on from here and moving to the actual sessions that we have planned for you, I'd like to give you a very, very brief overview of Dr. Jyoti Clara J. Michael, Director of Nursing, Strategies and Planning, India Operations Division, Pathway Healthcare India Private Limited. About Jyoti ma'am, I think many people may not really want an introduction because she is quite popular with all of these, many webinars, and most of us even having worked with her. Awards and honors: Most Innovative Healthcare Leadership Award in July 2020, International Travel Award from MNR Midwest, Deanship Training University from Wisconsin, USA Rotary Vocational Excellence, Academic Excellence and Research Award from Omialachi Trust in 2013, Healthcare Poet, which was appreciated by University of Wisconsin, led the team to hospital evacuation to 2015. Leading Corona across IOD. Added credentials: being assessor for NABH, core committee member to bring Principal Nursing Excellence Program for NABH Nursing Excellence, being the principal lead, assessor and faculty of POI, developed critical care nurse practitioner standards, practitioner program member, education committee member, INC Inspector for Clinical Establishment, Tamil Nadu government. Over to you, ma'am. We want you to kindly introduce the speakers for the day and take us through the program.
Thank you, Joy. I am so delighted today because Annie had a birth during the conference that we held, and I must thank AHPI, and in fact, Samir is here because Sam was another instrumental person when Thankam was discussing for a long time that we have to host Annie, and a lot of work had been gone into it by the leaders. And I was a very late entry into Annie, but then I thought this is a wonderful platform for me as well, and for all the nurses to be in, so that this particular platform will not only elevate us, but it will also help us grow in our profession. And I take this opportunity to thank Ms. Elaine for kindly consenting to be with us as a chief guest for the day and giving us wonderful thoughts for all the participants, the young nurses. And I'm sure all the messages that has gone in, it will be a good learning for every single participant, those who are here. And having said that, I thank Ms. Thankam, and Thankam has introduced herself, but it is my responsibility to introduce my other family ANEI members. And other family ANEI members, like we are Indians and we are together. We are from different states, but we stay united for nursing. Nursing is a cause, we get united, and we have our ANEI officials across India in every state that we have in India. And that is a great credit for us. And we have some of them joined in already. So may I request the ANEI officials to just come in and give a word of encouragement to the participants. I could see Josephine, Gopa, and our Shubhada, who is our secretary, she's also here in. So may I request you to just come in and then give a word of encouragement. Shubhada, please start.
Hello, everyone. Hello, everybody. I
Yes,
hope
yes, Shubhada, you can continue.
I'm very happy to be here, and let's have a wonderful session. Thank you very much.
Thank you, Shubhada. Gopa.
Good afternoon, everyone. I'm Gopa from Kolkata. I'm the EC member and also the president of Kolkata chapter. It's a very nice to meet all of you, especially the program, what we are going to have it. It's very interesting, and I wish all of you a very best of luck. Thank you very much.
Yeah. And we have, thank you, Gopa. We have Josephine with us.
Thank you.
Hi everyone, good afternoon.
Good afternoon, Josephine.
Hello, am I audible to you all? Yeah,
Yes,
good afternoon. So, yeah, nice to see Madam Elaine speaking. I remember years back I met her, and congratulations, Dr. Clara, and everyone over there, and all those who are participating actively in this program. I'm so happy I could log in and listen to you all, the introduction part. Wish you the very best. I am based in Gurugram. I am at Artemis Hospitals. Thank you so much.
Thank you, Josephine. Any more EC members in the group? Please unmute, introduce yourself to the team, because nursing team should know the leaders. Leaders have to be visible to them, and already we are visible, but please come visible here in this web conference.
We have 264 participants. I think I saw Neelam coming in. I'm not very sure.
Okay, then we will
see. Neelam, are you there? You can say a word. Okay,
we will reserve it towards the end, because
yeah, ma'am. Hi, ma'am. Good afternoon. I'm there.
Okay.
Thank you so much. I congratulate to the team, and it's very exciting, and I'm very happy to to attend this webinar. So thank you so much once again. Congratulations.
Yeah, thank you, Neelam. So we will proceed with the webinar session presentation now. May I request all the participants to unmute. May I request all the participants to unmute. Respect the senior professionals who we have invited. They are all very busy in their business, and they have come here only because they respect nursing. And let us focus on learning now from next few presentations that we are going to hear. Nursing professionals' practice has evolved with advancement in cutting-edge technology in healthcare sectors, medical, IT, and engineering to pace with the advancement. Nursing profession strives its best to optimize resources, shapes, and sharpens competencies, paving way for newer titles, recognition for the role nurses play. Robotic nursing is one such broader field nurses are opting, and the option is getting increased day by day, and Corona has paved a great platform for it. Today's webinar focuses on surgical robotics and nurses' role to give an insight and awareness to artificial intelligence in nursing. I need your help from
I'm going to mute all, then you can unmute yourself, Jyoti. I'm going to mute all. Okay. Please, ladies and gentlemen, please keep yourself muted. If I see that you are not listening, I will have no option except to remove you. This is very serious. We are going to get the speakers in. Please respect yourself and others. I'm going to mute all. Jyoti, you need to unmute yourself.
Thank you, Tankam. Today's webinar focuses on surgical robotics and nurses' role to give an insight and awareness to artificial intelligence in nursing. Breaking tradition on repetitive roles, which does not require customization and critical thinking. The pandemic has given us a new learning and need for taking away repetitive tasks of a nurse, allowing the nurses to focus on individualized and customized care, clinical judgment and critical thinking, and empathetical approach with human touch, which cannot be replaced by the robots. We have with us Dr. Shiva Shankaran, MS, MCH Fellow, Urology Oncology, Urologist, Hindustan Hospital, Coimbatore. Dr. Shiva Shankaran, with his urology team, Dr. Ramalingam and Dr. Sendil, is greatly contributing applying robotics in surgery with his interest around uro-oncology and minimal access invasive surgeries. Written chapters in Operative Atlas of Laparoscopic and Robotic Reconstructive Urology in Springer, and presented papers in national and international conference, to mention few: American Urology Association in 2018 and 20, and World Conference of Endourology in 2010. He says his passion is to serve the people and make surgical procedures as precise as possible, giving best clinical outcomes and delightful peri-operative patient experience. Over to Dr. Shivashankaran to give an outline on robotic surgery. Dr. Shivashankaran.
Thank you, Dr. Jyoti Clara Madam. At this outset, I would like to thank everyone who have participated in the meeting, and the participants number goes up to whopping 275, which is like excellent. It's awesome. And I would like to especially thank Ms. Eileen, who is the chief guest for the program, and also a special thank you so much, Madam, who has given us the opportunity to. I'd be happy if everyone have muted themselves so that I'll be audible to everyone. And I'm sharing my screen to everyone who is listening. I'm just yeah, just a second. Okay.
Yeah, your screen is visible.
Okay. I'll just go ahead with my presentation. And thank you, Jyoti Madam, for giving me a great introduction. To all the participants who are very eager and keen to know what is robotics and what is the role of surgical nurse in robotic surgery, I would be covering very few basic points of robotic surgery from a surgeon's perspective. From a nurse perspective, my next speaker, Saraswati Staff, she will be speaking about that. And I'll just finish my presentation in a short, like 5 to 6 minutes. So I would like to thank Dr. Himesh Gandhi, who is my good friend, who is a robotic consultant in Ruby Hall, Pune, who agreed to share a few videos with me for educational purposes. So what is robotic surgery? Robotic assisted surgery was performed in 1985. It was basically a neurosurgical procedure. And with its success, the first robotic assisted lap cholecystectomy was performed in 1987. And in 2000, Davinci came in the name of intuitive surgical, and it was first approved by FDA. The company's marketing at that time was done for improved dexterity, improved visualization, and consistency when compared to the current standard laparoscopic surgical technique. And by 2019, there were more than 4,500 hospitals which have invested in this technology, with a major bulk mainly in United States, covering into Europe, Southeast Asia, and also in the rest of the world. And all this robotic surgical studies which have been published thereafter has been shown to have quicker patient recovery times, less blood loss, shorter hospital stay, lesser scars, and less pain, and making a surgical procedure a comfortable one, both for surgeon as well as for the patient. So this is the statistics. By March 2019, the Davinci, developed by the robotic surgery company called as Intuitive Surgical, completed about 5 million surgeries in 2018 through more than 4,500 surgical robots sold by the company worldwide, which is a whopping number actually. And in February 2020, our national, the Hindu, published an article saying that 50% of all the surgeries will be robot assisted by 2025 by a study conducted by L&T. So, coming to the point, I was listening to the introduction given, and has the role of the nurse been replaced by a surgical robot? I would say no. A surgical robot is an instrument which can help or assist in performing a surgery, but not replace a staff nurse. So the staff nurse have to understand that their role is very, very major, and it is like any other procedure we are doing. So what are the major drawbacks in a robotic surgery? Despite the exponential growth, implementation of a robot costs are very much prohibitive for smaller healthcare systems, especially in developing countries like India. And additionally, there is definitely a need which is required for easier docking and setup of a robot, for a better haptic feedback, for better stapling, hemostatic devices, and also a lower system and instrument recurring costs. So when we are assessing the values of robotic assisted surgeries, several factors have to be considered. For a surgeon's perspective, it should be like the ability to facilitate an otherwise difficult procedure. From a patient's perspective, appeal as the state-of-art technology promising reduced incidence of pain and lesser hospital stays. And from the hospital point of view, its effect in decreasing the and overall financial impact on its operations. So what is robotic surgery? If you can see in this picture, this is called as the surgeon's console, and this is the surgical cart, and the last one is the vision cart, which will have all the accessory machines. So in the surgeon's console, the zoomed portion is this one. This is the main part which helps in performing the surgery for a surgeon. This is the point where the surgeon will hold it through his fingers and then do the surgery. So I have a short video from a friend. This is the surgeon's console, and you can see him operating with his hand, and that is the movement he's doing with his and that is the robot, the main robot machine which is operating on the patient. And the movements of the operating system has been extrapolated onto the.
I'm sorry, Dr. Shiva, just give me a moment.
Yeah.
Let me participant Sarla Devi Satya, please mute yourself. Somehow you people are not trying to understand. Kindly mute yourself and stop your video also so you can see what is happening. Can you all mute yourself? Dr. Shiva, I'm going to mute all and you can unmute yourself. Dr. Shiva, please unmute and speak.
Yeah, madam. So this is the main surgical thing that is going on, where the surgeon's actions are all extrapolated onto the patient, and that is the assistant surgeon and the staff nurse who is sitting on. So what are the difference in the instrumentation while we use in a laparoscopy as when compared to a robotics? If you can see, this is the instrument which we use in a laparoscopy. It has only two movements, that is the rotation like this and the rotation of this tip of the instruments, and you can move in and out. That's all. These are all the only movements that we can be done in a laparoscopic instrument. But in comparison, when we do it in a robotic instrument, it can rotate this way, it can move up and down, it can move in and out, and the tip is going through a wide range of movement, and you have this grasping directional activities also. So in comparison, this is supposed to be a more versatile one, which is making the life easier for a surgeon, which can be helpful in doing surgeries in areas where it is difficult to perform any laparoscopic procedures, especially in the pelvic surgeries. So if you can carefully see, these are the instruments which we use for the laparoscopy, but this is the instruments which we use in a robotic surgery. And this image shows a laparoscopy. You can move this way or that way or up or down. But if you can carefully see in a robotic procedure, this is all the surgeon needs to do. Just grasp with this index, middle and the thumb finger, and that is all. The actions which are done by the surgeon in this region has been extrapolated onto the body. And there you can see the wide range of movement the instruments are exhibiting. It can go in, it can twist like this, it can turn, it can just make life easier for the surgeon, and making it very precise also. So this is a small training video wherein you can see the peeling of the skin of a plum fruit. You can see the precision in which this instrument is operating. I mean, the surgeon is very comfortable sitting there and training on his console, and this is the way the robotic instruments perform inside the body of a patient. Very precise, and it is very meticulous when it compares to minor and surgeries requiring expertise. This is another training module wherein the peeled skin is just kept there over the plum fruit, and with the help of the instruments, you're trying to suture it. If you can carefully appreciate the movements of this, see, All these things are very, very meticulous and very precise. You can see the activity and the rotational of all these tips of these instruments, right from here till here. It makes a lot of difference when we are doing a robotic surgery as well as when we are doing a laparoscopic procedures. So coming to the urological perspective of robotic surgery, it can be useful in a prostate cancer, kidney cancer, it can be useful in a urinary bladder cancer, adrenal tumors, urethral cancers, testicular cancers, and as well as penile cancers. Almost all the cancers related to urology can be done in a robotic surgical procedure. And as everyone knows who have been attending this program, the open surgery involves the surgeon, and this is how it will be looking like. But in a robotic surgery, it is entirely different. This is the staff nurse, this is the assisting surgeon who is standing nearby the patient. There is this robotic machine, this is the observer cart, and there will be in one corner, the surgeon will be operating from the surgeon's console. So what are the advantages? Less scars. You see, this is the scars that is after the procedure of a robotic prostatectomy, which can be otherwise a midline long incision. And this is how for a robotic procedure, the scars will be looking like. And this is a small video with the permission of the patient. This is the next day after a robotic procedure. And you can see the confidence in the patient in walking, and he's very comfortable with the catheters by the staff nurse sideways. So the scars I would be discussing, these are all for the open surgeries, prostate, bladder, and kidneys, whereas these are all the scars for the robotic procedures. So what are all the advantages of the robotic surgery? I would like to touch upon a few things. There is magnification of about 10 times, significant visual advantage, and perform more accurate and precise dissection, as I shown in the training video. There is 7 degrees of freedom of movement, which is actually one more than the human wrist, which actually gives more help to the operating surgeon. And surgeon is immersed in a 3-dimensional image of the surgical field. And there is less physical strain on the surgeon, which actually makes surgical in a robotic procedure a very, very comfortable one. And the movements are very intuitive and very precise. And there is also motion scaling for filtration of the tremors. The tremors are not extrapolated onto the patient. The robotic machine will take care of all the filtration of the tremors. And with this small introductive talk about the basics of the robotic surgery, I would like to ask my next speaker, Saraswati, to go on explain about the role of a surgical nurse in a robotic surgery. Thank you for patient listening. And I have few addendums, but you don't need to know about all these things. And Saraswati will be explaining. And the list of procedures which will be covered in this robotic procedures are prostate, ureteric implantation, can be bladder surgery, can be bladder neck suspension, can involve gynec surgeries like hysterectomy, can involve general surgeries like abdominoperineal resection and sleeve gastrectomies, a whole variety of surgeries involving the gastro and gynec and urology can be done in a robot assisted. And thank you. And this is my email ID. Anybody who is interested in asking any questions can mail me and I'll be happy to help. And thank you once again for giving me this opportunity.
Thank you, Dr. Shivashankaran. That was a very elaborate presentation, and I'm sure it would have been very clear because more of visual you brought in. Thank you. And we have now Vasanta Kumar Saraswati. Saraswati hails from a city called Coimbatore in Tamil Nadu and is currently working as a nurse in Mount Elizabeth Hospital, Orchard, Parkway, Pantai Hospital at Singapore. She completed her diploma in nursing from D. Kuppusamy Naidu Memorial College of Nursing, Coimbatore. I am sure the college students and the faculty are also into this Zoom call. And she has worked in the same hospital and then she moved into Malaysia. So she migrated to Malaysia and she was working in Malaysia in the operation theater from 2000 until 2007. And what attracted Elizabeth Hospital, and then she continued to work in Mount Elizabeth Hospital in Toronto. Her career path has been greener with ongoing credentials such as preceptor certification and advanced diploma in nursing in Singapore and degree nursing from Griffith University in Singapore affiliated to Australian University. Ever since she graduated, she kept updating her knowledge and competency, and you will never see a year that is missed by her attending a conference or improving her competency or knowledge. Her OT specialization is in all area like gynecology, ENT, liver and kidney transplantation, neurosurgery, laparoscopic and robotic surgeries as well. With 5 years of experience in robotic surgery, she worked with the Davinci robot version S, assembling and calibration of the system, stripe drape robotic arms, and fixing of a scope and instruments, changing of the instruments in the arm, passing sutures and clips into the operating field. From GKNM College of Nursing, Coimbatore, the ex-principal Professor Chandani Tyagi, the present principal Dr. Jaini Kemp, congratulates Saraswati for having grown to this level, and it is all by her effort and the support of the senior nursing leadership. Thanks to Hospital Don Joling and Miss Josephine Ong, the Don of SOD, Singapore Operation Division, for the motivation that is given to Saraswati, because she always keeps telling it's only because of the senior leadership motivation she has grown to this level. Over to Saraswati. She will be sharing her robotic experience with you nursing colleagues. Saraswati, please, you can upload your presentation now.
Good afternoon. So I tried to upload my PowerPoint now. Just give me a minute. There is some issues here.
You can share your screen.
Good afternoon, ma'am. I tried to get my slides over here. So just give me a minute. Sorry for the delay.
Saraswati, are you able to share the screen?
Yes, but I tried to get the PowerPoint slide one.
Okay. Open it on the desktop and then share it.
Yeah.
Participants, is it not interesting that somebody born in Coimbatore and then she has grown up to this level that she is able to be competent in something that is the recent and advanced technology, and she is competent to handle robots and assist the surgery. I think it's a motivation that all young nurses, those who are participating here, must know. It's not where you're born is important, but how you have grown is important, especially when it comes to nursing profession. It is not that everybody should aim to become nursing administrators or leaders, but there are greater opportunity for you in various fields nowadays because of technological advancement.
Sarah, you got to on your PowerPoint on your desktop first.
Yeah. Oh.
Saras, just when you do share screen, it will ask you
yes, ma'am.
entire screen or desktop, and then pick up your presentation. Maybe you stop sharing, and yeah, now open that. Yeah, that's it. Yeah.
Yeah, that's it. Yeah.
You can able to see, no?
Yes,
Yeah.
we can see. Thank you.
Okay,
Yes,
good afternoon to everyone and the panel of judges. Our special guest, Miss Elaine. Today I'm going to discuss about the surgical robot nurse As a surgical robot nurse plays an essential role in a surgical field in the complete of a successful surgery. As part of a surgical team, high-level professional knowledge and expert in robotic surgery and technology dealing with the robot function and the malfunctions. These are the specifications the nurse should need to learn before enter into the surgical procedure. There are healthcare advances fast. It is a healthcare to learn and adapt in the modern world. Advanced technology benefits healthcare professionals. Advancing technology benefits healthcare professionals related to surgical and non-surgical field and potential healthcare record as well. We need to update IT in the healthcare system. Davinci is state of art, widely used in the surgical field, and now is the world coming into the non-surgical field also. Many more arms in horizon and Korean and Chinese versions, it depends the various type of software installed in that system. Here I'm here to share with you about the Davinci robot system. Davinci robot system has a high-tech telesurgical system called Davinci. Robot has SI, yes, X, XI versions. Robotic surgery is a minimally invasive surgery. Robot shows 3D high-resolution surgical field. It allows the surgeon to operate the robot arm with her or his finger, controls the button in the station to perform the surgery. What you are seeing in the screen is the Davinci. Yes, it is introduced into the surgical field in 1995. It consists of console, it's a console, and computer stand interface, and patient sidecar. There are some advantages in the robotic system. Robot arms work even better than the human race, where it can bend twists at angles that we can't do it with our hand. This is SI Davinci system. Some modifications in the system they bring out into the surgical field in 2019. It has central dashboard. You are seeing in this. This is the central dashboard is here. It's more comfortable for the surgeon to handle the robot system. And this is next to the SI version modified is X model. X model introduced into the surgical field in 2014. It has a thinner arms and instruments. It is benefit for the lower abdominal procedure like a prostatectomy, hysterectomy, and hernia repair. This is the latest and more advanced technology combined. Its version is XI model. It is introduced into the surgical field 2015. Tiny instruments and lightweight endoscope. Surgeon views real-time 3D high-D video output from the camera and remotely operates the arms accordingly in order to perform the desired procedure within the patient's body. What you're seeing in the screen is the robot S model. This is the version I handle in my experience. So now A is a console. It consists of right port and the left port and the patient's hand manipulation system. The right port, right port communicates the major system error and turns the system on and off. Left port helping to configure the telescope and the system. This is the ancillary cord. This is camera arm. These two is the instrument arm. And the vision cord consists of monitor, speaker. This is the speaker. During the surgery, communicate with the surgeon. Surgeon communicate with the team members. And the VCR, COT insufflator, camera unit. Camera unit, little bit different from our normal laparoscopic system. Camera head connector. This also the different from the normal laparoscopic system and CO2 cylinder and Illuminator. Illuminator is specific for these robotic light cables. There are so many types. In the modern world, most of the surgery specialties move on to the robotic system to do the procedures. Robotic assisted radical prostatectomy, and nephrectomy, hysterectomy, and pyeloplasty and oncology procedures. And robotic surgery, what is the advantages? It's minimally invasive, precise, 3D version, assisted movements, ergonomically safe for surgeon. There are some advantages also. Long hours procedures, large robotic arm, loss of tactile feed, limited variety of instrumentation, total time increase the cost for the patient. It's a long hours procedure. Surgical robots are closely to maintain. Sorry, it's costly to maintain. Its maintenance is bit expensive than the other normal laparoscopic procedures, instruments, and the system. Preparation of robot, example is a docking. And there are some complications, same like other laparoscopic procedures. In the robotic procedure, the specific complications including the positioning is a head lower. That time, patients all the way in the lower head position. It causes occlusion of ocular edema. So during the procedure time, anesthetists and the AU nurse observe the eye function. Robotic surgical team, surgeon, anesthetists, nurse managers, surgical robot trained nurses, anesthesia nurse, Davinci Vento, robot trained assistant, operating room assistant. These teams must expose with the surgical procedures of the robotic system, of handling the robotic system and the instruments as well. Surgeon console. So we need to, nurses teams need to handle the surgeon's console and the robot arms and how to drive. These are all the things we need to learn. Perioperative phase. Under the perioperative phase, make sure robotic operating team members should have the training to identify workflow and manage troubleshooting issues. Operating theater arrangement should be done prior to the surgery. Robotic instrument sets and equipments to be available in OR. Robotic nurse coordinate has to arrange the staffing as per the case. Nurses team must up-to-date their skills to provide quality of care. So this is the surgical setup of the robotic theater. This is a monitor. There is 2 monitors. T1 to T2 is a trolley for the nurses. This is the irrigation suction and irrigation system, anesthesia machine, and this is the diathermy. This is the console system, is a major part in the surgery for the surgeon. This is the Davinci system and the operating table positioning with the lithotomy positions, how that depends on the surgery. And the nurse to be here, for the assistant to be here to assist, coordinate with the surgeon. And the anesthetist is standing on the head part. This is a major part role measures procedure done by the surgeon. Anesthetic nurse responsibilities to prepare all the trolleys is anesthetic trolley, intubation trolley, setup, IV infusion, anesthesia drug trolley. Prior surgery must all the machines to be function and the equipments to be available. Requested the drug by the anesthetist, the drug should be available in the theater. Apart from that, to assess the patient, check the patient consent with the 2 identifier, either patient name, IC, or date of birth. Make sure the patient wear the stockinette to prevent DVT pre-operatively. wheel the patient to OR, and completion of the preoperative and preparations. OR team assists the patient to move the operating table and connect all the monitors and read the baseline parameters. And the circulating nurse role, coordinate with the OR assistant, prepare for the patient's safety measures like positioning aids. Positioning aids like here, you can see the pictures here. There is a soft pad for the skin, prevent skin injuries. This is a glove to protect the fingers during positioning aid. This is the slip mat to prevent patient slip from the cable during the position, especially head down. This is the shoulder support. Shoulder support also help to prevent patient slipping. Sacral support for the long procedures to prevent sacral pressure and the skin injury. And the pneumatic foot pump improves the blood circulation on the leg during the procedure. Bar hugger maintain the body temperature. Inside the theater, so many instruments, the room to be very cold, so it helps to maintain the patient's body temperature. Foam pad for the arm, it helps to prevent injury and then muscle and nerve injuries during the procedures. Make sure all the equipment are in working condition. Check OR temperature and humidity. It reduces infection. So here, the robotic function must be checked before starting the procedures, assembling of the arm, draping of the arm and with the sterile drapes. And this is the system for the calibration. While ago, you are seeing in the picture, there is a right port and the left port. This is to press the button to start the robot system, do the self-test. And the second step, to press this ready button to homing the system. And after homing and the self-test, we stand by the mode until the system dock in. This is an emergency button. If any consequences during the procedure, we use this button to take the safety measures for the patient and the surgical team. So after calibration, we need to drape the robot. Each arm we need to drape separately with the sterile drapes. And after draping, we need to cover these robot arms, keep sterile to avoid contamination until start the docking process. It means the robot go into the surgery, enter into the surgery. This is how draping of the robot after calibration. You can see here is the instrument arm. These are the things we must know, the responsibility of the circulating and the scrub nurse to learn how to do. There are so many processes here. Need to fix this instrument, drape the instrument arm first, then put this instrument holder. This is the sensor, and this sensor need to touch with this instrument. This is the round thing, the white thing. It to link with each other, then only the instrument will work during the procedure. Okay, there is a here, you can see port holder. After draping, this port holder need to fix into this arm. There is a screw here. You can see the screw. This screw to be seated in this part. Then only during the procedures, the trocar will be stabilized. This is the camera holder. Camera holder, this part is sitting, this part is helping to hold the camera. Telescope. This is the clip to secure the endoscope. This is the base of the card. There is a scrubber's role. Some of the instruments we have to check accordingly during trolley preparation. Always we go with the instrument checklist to prevent error and make sure all the equipment are available according to the list. And we prefer the surgical pick list as per case. Number one, this is the camera and light cable cover, endoscope here. Okay. Number two is the endoscope. There are 30 and 0 degree. This is heavy, telescope is heavy, this is the S version. And number three, alignment toggle endoscope. Number four, sterile adapter camera. Number five, camera mounts instrument arm. Number six, wrench, emergency grip release. This is very important how to use, when to use. Number seven, latching actuator. Number eight, rubber band. Number nine, endoscope holder. Number 10, instrument arm is 8 mm. This is the 8 mm board. So after draping, we need to do the white balancing and the black balancing. Normal laparoscopic procedure, we do only the white balancing. For the robotic system, we need to do 2 steps. The camera need to drape. Number one, you can see the number one picture shows you how to drape the camera. After draping the camera, need to connect the camera head into the telescope. After that, need to connect the light cable. After connecting the camera head and the light cable, do the ABC. ABC is a automatic black balance. So this time, coordinate with the circulating and the scrubness to complete the ABC. Same thing, the AWC is a white balancing. Here, use the white paper to do the white balancing. And the camera, there are 2 degrees we are using for the endoscope, 0 and 30. In the calibration mode, we have to adjust, we have to do the 2 separate, 0 and 30, and with the scope alignment. Now is a 30 degree. 30 degree is like slightly 45-degree angle in the scope alignment. If a 0 degree is a 90-degree alignment. So this is how the laparoscopic instrument working inside the patient during the procedure. How our hands move all the angles, the same thing the robotic arms can move. So robotic instruments, no need to worry to memorize the instrument's name. All the names is stated here on the instrument. Okay. So there are specification in the instrument arm. Instruments. There is a duration of the instrument to be used for the cases. System will track for the instruments, how many cases can be used. So here you can see the picture, how the 3D field is getting from the scope and the console system, all linked with each other. So it's a computerized system. That's how nurses need to learn the IT to compromise with these procedures. So 30-degree telescope is a 12 mm. It gives the image. You're seeing in the number 3 picture here. Surgeon is sitting in the console, viewing with the surgical field. In this, is a 2 eyepieces here. And the number 2 is the link with hand movements. There's a finger movement. It goes with this part of the angulations of the instruments. So it's more comfortable for the surgeon. It's very slim and flexible. The tips are very slim. So surgical team role. What is the surgical team role here? We need to understand AU and circulating nurse role to assist during the anesthesia and coordinate among the team during the surgical positioning is very, very important to save for the safety measures for the patients and the surgical team to prevent any injuries and pressure sores, pressure point illness. And the surgical preparation of the patient is a prepping of the patient of the operating site After draping everything, we do the time off, confirm the correct procedure, correct patient, and the correct site. Use the two identifier. All the connections of electrical cables and tubes check before surgery, ensure safe connections, and works well. Inter-op surgical preparation robots system is a docking of a system. Before docking, the surgeon will put the trocar in, insert the trocar as like a laparoscopy procedure. Then after that, we move on to the patient cot close to the patient, then connected to the port. That is called as a docking system. Then the main surgeon move on to the surgical console, then link with the robot console and the machine. Throughout the procedure, we have to carefully monitor the patient safety measures. So what need to do is we have to monitor the patients, any arms pressure, any arms resting on the patient, it gives the pressure to avoid that to be happen. So continue monitoring from starting to until end of the procedure to avoid pressure and injuries and any consequences during the surgery. And the robot arms movement also must be noted. If unlikely movements, to inform the surgeon immediately to rectify it. During the surgery, follow the instructions like change of instruments, passing switches, and the suctions. You can hear these all the wordings from the speaker what surgeon is talking from the console, sitting on the console. The team members must know how to read the words appear on the screen. Tell the monitor, tell the on the telemonitor, do the rectification immediately. For example, the instrument can't be used anymore. So it will show the time duration, instrument cannot be detected. So we have to replace the instrument. That is the most important role. Then that time we have to communicate with the surgeon and the assistant and the circulating is the whole thing to be aware. And the post-op replenishment is the surgical instruments cleaning and safely transfer the patient to the recovery and cleaning of the instruments, all those things like other laparoscopic procedures. Especially here, the laparoscopic robotic instruments, the scrub nurses to be washed and packed is very precise, and we need to thoroughly clean to prevent infection and the contamination to the next patients and the other instruments also. Thank you so much for listening. Thank you, ma'am.
Thank you, Saraswati. That was a very elaborate presentation. We are getting on group chat. People are asking for all the material that you are presenting. So thanks for all the effort that you have taken to fix all the pictures, illustrations, and the detailing of the entire role of a nurse. So I think it's like an open book that you have given to all of us. And thank you so much for all your effort. And thanks to Mount Elizabeth team who has supported you on bringing this on board for today, for all of us to learn. Thank you, Saraswati. And now we are moving on to, you can remove the screen sharing.
Yes.
And we will allow the next speaker to come on. Thank you, Saraswati. So the next speaker for the day is Mr. Samir Mehta. Mr. Mehta is the Chief Investment Director of Atlas Family Office and the Vice Chairman of Dr. Mehta's Hospital, amongst India's oldest and most respectable private hospital. SAM is the co-founder of the number of entities, including India Home Healthcare, Arya Play Games, and Atlas Intelligence, and participates in various national healthcare and investment advisory committee. He serves on board of number of Arya funds, Proclaim Technologies, IIT Madras Rural and Technology Incubator. Mr. Mehta brings over 2 decades of enterprise leadership, multinational operating, project management, governance, strategic counseling, investment management, and entrepreneurial experience within leading organizations like McKinsey and Co., Shell and Fortune 10, and family businesses company across multi-sectors, healthcare, education, energy, chemical, food, technology, and retail, and many, many across Asia, Europe, Latin, and North America. He is a former venture advisor for TVS Capital and election observer with the OSCE UN. Mr. Mehta is a regular speaker and governing advisor at international conferences and symposiums.
Yeah, let's put across this. Mr. Mehta is not important. The nurses are important.
Okay. Mr. Mehta, the co-founder of Value of Entrepreneur Games. And I just wanted to mention this, like Mr. Mehta is a, next slide. His profile is not limited to what is told here. His liberation is infinite. The most important fact that I want to tell here is he is married and is outnumbered with twin daughters and a cat. The finest leader with whom I have long-time association with mutual respect and constant connect in all good and bad times. Over to Mr. Mehta.
Hey, thanks, Clara. I think a lot kinder words than I truly deserve. But it's truly a privilege to be here, I think, with many of you. I know these are exceptionally tough times and you're on the front line. And many a time when the doctors are scared, when the families are scared, when the administrators are scared, you're the ones who put yourselves in harm's way, especially where we have an unknown virus. So for that, I think our sincere thank you, not only from us, but our whole profession, because I think sometimes we forget to say the simplest words, which are the most important, that if you weren't by our side, we wouldn't be here. So I think from one of the slightly older hospitals, let me jump in into the content. I've had the privilege of sharing time all the way from the earliest days of ANEI, and I have to say, really privileged and proud to see how you guys have evolved. I think many of you who are not members of ANEI, please join immediately. If you've got friends and affiliations or other hospitals that are not there, get them on board, because the quality of the programs that I've seen, Tangam, Clara, Lena, and many of the others that are on the governing council, both regionally as well as nationally, I think is outstanding. And I think AHPI, as one of my roles, will always be a privileged partner to you, because frankly, I think if we're honest about it, and it's about 70+% of all the unit processes in most hospitals are run by nurses, right? And I think most people tend to forget that when you break it down, if you're carrying so much burden, it means they're probably the most important single unit operator in the institute. And of course, one of the biggest populations. So I think from those points of view, we've had the privilege of sharing time for the last 87 years since our foundation. Dr. Mehta's, for those of you who don't know, was founded by my grandparents in 1933 at the times of the British. We are a center of excellence model. It basically took us 85 years before we had a baby. And that is our new hospital in also in Chennai. We believe, for us at least, healthcare should be very local and regional, because it's much harder to scale. It's much harder to make sure that your quality standards are similar across units when you're not physically present. We are family owned but professionally managed. I think many of the star leaders, Lena is one of them, Tilaka, and we've had many other privilege. I think I can see Josephine and some of our other alumni on. So it truly is a privilege to share time with people, because they're the ones who make us professional. Many of you will know Dr. Sarvana Kumar, Dr. Kannan, and these are some of our leaders. But I think we have on our leadership team meeting, one of the things we've always been keen on is that nurses need to have a voice. And the other things is, so we've got rich pedigree, rich history, lots of activity, but at the end of the day, we're here for our consumers, right? They are the number one reason that all of us serve. If we can make somebody's life better tomorrow than it was yesterday, we've done a good deal. And I think in that respect, sometimes we forget that it's also important that our team members and our partners and our families also should have a better day tomorrow than it was yesterday. And I think that's where I'd like the majority of my talk to focus on. Why is AI going to be interesting, useful, and not really a risky proposition for you? And I think the one thing that Dr. Mehta's is always to tall in is the fact that we work well with neighbors. I mean, we're the oldest of the surviving private hospitals because we lost a lot of really great neighbors out there. They've been great institutions that stood tall, but then made decisions, and some of them are no longer there. Some have been bought by others. And there's nothing wrong with that, but we kind of like to be in the company of good people we can learn well from. So a lot of the folks like CMC Vellore, Clara, I think with Global, and then Parkway Pantai, and before that even Tamil Nadu Hospital, we've been able to learn with them, with Kaveri, with Child Trust, with Sundara Medical Foundation, Triple M, Apollo, you name it. We've had the privilege of sharing time and therefore learning. So just jumping through, if you ever want to learn more about it, this is the one visual that I throw up for 30 seconds because it'll confuse all of you. I've had a very varied life, and that's only because I wasn't as smart as many of you. So all the way from starting and living and working in 5 different countries, I've now come back to India. So this is, I call India 2.0, where hopefully we get smarter. And the only reason you should perhaps pay attention to me is I spend a fair bit of time on the boards of a couple of companies in artificial intelligence. So let's get into content. What you see on the far left are actual real life robots that are working in hospitals. One of them is in Singapore, one of them is in China. And then the real question is, if you were a customer, who would you prefer to share time with, right? And if you actually look at these, and the stuff on the far right, for those of you, all of you know what it is. It's an Alexa, right? And you've got the Google Nest and similar assistants, digital assistants around you. But the reality is, this is what a nurse in a robot form is. It's a black box. It might have some good aesthetic features, but it's a black box. I would much rather spend time with these people because they smile, they do 100 other things, they make me comfortable in a hospital, they communicate with my family, they make sure that the doctor sometimes who has the wrong idea because they're looking at 5 different patients, so they got shouted at by the consultant on the phone, has the luxury of actually taking notes and sharing it with you. And if you actually look at what the nurses are holding, this is the reality of our world. Many of them are still using paper. In fact, 2 out of the 3 are paper-based, and the third one is using touch-based, but it's a slow touch-based interface. And I think what you find is a nurse today in most parts of the world is given baggage that really they shouldn't be carrying. So if I want you to learn a few things out of our session, it's some of these components. The first is a black box, who should you trust? And therefore, before you ever get to the black box, the first question a hospital as an administrator you'd have to do is make sure the quality of your data is good. And therefore, you have accessible data to multiple people like nurses to take decisions. And today, most hospitals are very secretive about the data, actually have very unclean data. They have so much data hidden in so many different places that actually it's not at your fingertips when you need it, right? If you had to find a PowerPoint slide that you made 1 year ago, it takes you a lot of time because that's the reality. And the one thing that I can tell you is the amount of data that we will create in 2020 is more than the amount of data that the world had before 2019, right? Put together. So that is actually a function of every year in data sciences you learn that every year that comes up, the amount of data that comes about is a sum of all the previous years, and it's still bigger than that. So if you have so much data, is that not going to hurt you rather than help you if you have to search through it? And that's a lot of the problem. The advantage you have, and I'm sincerely mean this as an advantage, is that most nurses are not a very high cost item for the decision maker of a budget in a hospital, right? If I was to look at an individual nurse, if I was to look at the head of nursing, if I was to look at those things, they're not the first people when I look at where should I cut costs, I would look at. And this is a great thing for you, because in the science of artificial intelligence and robots, I go to where the most expensive people are and I try to get rid of them. And that's why you're seeing the first robots appear in surgical rooms, because the surgeons are very expensive to most hospitals. And that's why the Davinci robot has been very successful in parts of America and other parts of the country, because can I substitute the top surgeon I have with a much lower cost surgeon with a Davinci robot, right? And that is how most people think as decision makers today, in areas where is my highest cost item, and that's what I substitute. The other thing is, nurses are amongst the most multi-talented and versatile team leaders that you will ever find in any team, right? So why should I ever substitute them, right? If I was a decision maker, dumbest thing to look at is where to swap nursing. So some of the things I'd look at is what is the cost per customer requirement. So what is the cost per inpatient or outpatient visit? And that's what I want to go and target. And once again, if you look at where the nurses are coming, or where the robots are coming, or the AI systems are coming, it's in areas which have very high cost per customer service requirement. And what the robot has to do is make that cost lower per unit, not higher. The Davinci has taken it higher. If you look at the Amazon Echo, it has made it lower, right? And so this is a fundamental truth of artificial intelligence systems, that it actually has to be lower per unit than it was there yesterday. So there is a lot of low-hanging fruit if I was a hospital decision maker. I first will probably do rule-based checking. I'd probably do error detection for AI systems. I'd probably look at medication and vital interaction. So if I give medication, what will the vitals change? I'd want to see the medication efficacy. There are lots of drugs that we give a customer that only 4% of that concentration of that medicine is actually working in that customer. So those are areas that AI will actually play a role first. And for a nurse, clearly, what is the latest nursing news? There's so much that's new every day. If I can use a robot to tell me what is useful based on my interests, that's actually really useful, right? So this is a real use case that we have live in Mehta's. It's in both our hospitals. It's with a company called Health Sensei. And this is a combination of, it has improved medicine adherence, and it has real-time monitoring with some alerts. Some of them are based on AI systems, but a majority of this is based on real common sense data coding. So there's very little AI here today. But why is this important? Because this system is going to enable AI tomorrow. So all these vitals are measured and it comes on our mobile phones. So it's there live today. For example, Lena wants to check what a patient is doing in any of our units. She can. In any of our ICUs, she can, as long as this technology is enabled. And I'll tell you how it's useful. So today, this is our hospital ICUs. All our hospitals are live. All our ICUs are currently live with the technology. Isolation wards, all the COVID isolation wards have it live across today. And we're actually doing COVID monitoring at home for a lot of our customers using the same technology. And the reason this is simple is you've got to understand what is the benefit, right? So the reality for us, why Dr. Mehta signed up for it, and these are some of the pictures, these are all taken in a hospital, our hospital, right? Is at the end of the day, they've got to be better than it was yesterday. For us, that is, it gives us superior clinical outcomes. So if I was to look at the first 30 days of COVID, we were panicking like everybody else. We were worried about whether we'd have enough PPEs. We were worried if nurses were going to turn up. We were worried actually if doctors were going to come on shift at night. We were worried which consultants were going to come to check on the customers. And we were worried whether customers would even come into the hospital. I fast forward now. We've treated about 1,500 patients. We've seen amongst the lowest infection rates in the country in all our ICU rooms. We've got, for pretty much most of our nurse teams, we've saved about 5 hours documentation because all the vitals go directly to IMR. And we've got it at a very low cost. It costs us and it costs anybody else around 10,000 rupees per bed per year. And what it really gave us was peace of mind at night because we weren't sure whether the doctor at night shift would come, right? We knew the nurses would come, but we weren't sure whether the doctors will come. We don't know if the doctors will have a family problem. We don't know all of those things. And it really meant that sometimes a my head of ICU could oversee what happens for some of my other units and make sure that we have the doctor who's there to pay double care to that specific patient because we're seeing some vitals deteriorating, and that weekend doctor or night shift doctor may not be as great as my head of ICU, who sometimes may be the guy who's suffering from COVID, right? So this is a real life use case. So I'll finalize my presentation with a little bit of controversy. And the reason the male guy here is a robot because most of the nurses are female. So I thought I'd give you something to at least think about. That, you know, what is our future? Is our future where man will share time with machine, or more to the point where women will share time with machine? And nobody really has an answer. What we do know as healthcare providers, as nurses, is that by you being the best person to keep in touch with the technology, you will be the last person who's ever substituted in a hospital. Why? Because the people who are not keeping in power with the technology will be the first hospitals that disappear. That was the same in 1933 when my grandparents were there. That was the same in 1960. It was the same in 2000. It was the same in 2010. It is going to be the same in 2020 and onwards. The nurses, the teams that are the most multidisciplinary will be the strongest to survive. Because come the end of the day, you're only in the business to keep your consumers happy and your tomorrow better than your yesterday. So in the world of artificial intelligence, what is AI? AI is really trying to become a junior human being, which is a robot or a computer program with some degree of internal thinking process or mindful sentience, right? It may not be live. It probably will be very limited. If you look at the robots and the AI systems today, they're very, very limited. But if you look at, for example, an Amazon Echo, it is quite multidisciplinary in nature and it suits the purpose perfectly. I don't want to touch the remote control. I talk to the robot. I want to know the latest news fast. I talk to the robot. And I think that's what you will have in hospitals nearby soon. You will have these smart systems like we showed with that Health Sensei tool. And there are many others like that. There are chat bots. There are things that answer nurse questions for you. I think that's what you see. And I think as long as you as nurses keep on track and like technology, I think tomorrow, just like the first nurses that learned about the Davinci robots or the first doctors that learned about that, you will be ahead of the game rather than most of your peers that are behind the game. And the good news for you is you're already in super short supply. The great news for you is you're not an expensive thing in super short supply. So you will be the last people who will be impacted in the wrong way, is my sense with the systems of AI. Thank you.
Thank you, Sam. That was very intelligent insight that you have given to all the nurses. Dear nurses, participants, please catch up. If you are not into IT understanding, we will not be lost. Nursing informatics, very important. So let us go back and then brush up and see which is the area that we are working, which will help us to improve our knowledge. So having said that, Ms. Elaine has to step into another meeting, and it is time for us to give thanks to Ms. Elaine. Thank you, Ms. Elaine, for being with us, and it was wonderful having you here. Sam, actually, Elaine was mentioning that she had been with us in the previous conferences, and I think you should give a note of thanks to her as well, and then I call upon Tangam to give a note of thanks, and then Elaine could leave.
No, thanks, Clara. I think, Elaine, I still remember the time when we were in Global at that last event where I think we had Dr. Gyani and many of the other star nursing leaders, including some of our nursing friends from the United States and Singapore. So I think it's great that you're here. It's great that you're sharing more time. We'd love to see more of you, especially after COVID. And I think more than anything, keep empowering your nurses. It's areas like that where we will start seeing the first nurse board leaders. In fact, we're seeing the first nurse CEOs already across India and across the world. But I would expect to see many more nurse leaders across the world. And I fully voice what you said. You may want to move across an institution, but don't leave the profession. I think you're one of the rarest professions and one of those that have actually held strongest across human society. Frankly, I think if I had boys, I'd tell them to go find a great nurse to marry. I have girls, so I have to worry about different things for them, as the saying goes. But hopefully, as with lives, hopefully there'll be more robot nurses that come along, at least males that will do a lot of the heavy lifting. So I think that may be a great area that you can look at. And I hope that Parkway and the entire Parkway family of institutions continue to support institutions like ANEI to make them much better, stronger, because they're already great institutions. Elaine.
Yeah, thank you, Elaine. Thank you, Sam. And Tankam? Ms. Tankam?
Sorry about that. I was muted. It's a great privilege for me to be saying thank you to Elaine for consenting to be with us on ANEI. And as you said that you can move institutions but don't leave the profession. And I'm one classical example of not leaving. Even when I got a chance, I said, if I leave nursing, then who is going to be in nursing? So I totally agree with that. I think those who are staying, great. Those who are not staying, they can still contribute to nursing in different ways. I mean, even if you become a CEO or CEO, it can happen. Elaine, your introductory sentences were great to start the webinar, and official thank you notice to come from someone else. So I'll take a quick chance to say a very big thank you to Elaine, Saras, Dr. Shiva, and Sam. And Sam at least reassured so many times, don't worry, you are not going anywhere. Let the robots come, nothing is going to happen to nursing. And today morning, I was addressing a large number of fresh entries into a university for nursing program. So I was addressing them. So I told them the same thing. If you are a nurse, don't worry, you will always have scope of finding a job, because nobody can replace nursing entirely. It is not going to happen, because that is healthcare. So once again, a big thanks to Tamil Nadu chapter once again for such a progressive topic. And Elaine, thank you so much for being with us, and wish you all the very best. And as Sam said, let's find areas of collaboration where we can actually get nurses involved in creating that good thing to go in, so that the AI can come out, not the crap in and crap out. We can make sure that we get the right thing in at the right places, so the AI can truly help nursing. Because I envision that nurses spending a lot of time trying to plan care, etc., where AI can actually tell that this is the care that you should be planning for the patient. That saves a lot of time, and slowly they'll start to learn. Thank you so much, Elaine, and wish you all the very best.
Thank you.
Thanks, Jyoti, for asking me to say that few sentences. Thank you very much.
Thank you, Tankam, and thank you all speakers. Ms. Elaine is sending wishes. I got a WhatsApp message from her. There is some connectivity issue for her, and she really missed it. But she has sent a message that it is wonderful being with all Indian nurses and the speakers, right from Mr. Samir Mehta and Dr. Shivashankaran and Saraswati. You had justified for the effort that has been given for this this particular webinar, and I'm sure the participants are with so many questions. And now we quickly go on to next few questions to start with. May I call Joy to take over?
Right. Hi, ma'am. Yes, I'm here. Can you hear me?
Yes.
Right, ma'am. After all this, very intelligent interactions that we've had at the outset, I'm thankful to all of our speakers and to Dr. Clara for taking us through the entire program. This is now basically natural intelligent nurses versus artificial intelligent robots. So we have a very huge future ahead of us, and wonderful budding nurses who are being trained. I can right here. I will now open the floor to Dr. Devakirubai from the Tamil Nadu chapter, who's our EC member. She's a professor who's working with the Sacred Heart Nursing College. Ma'am, I'm able to see you somewhere in the crowd. So would you just turn on your video and put in your first question. Dr. Devakrubai.
At the outset, I would like to thank all the speakers, for enlightening us on the nuances of robotic surgery, because I know that it's an emerging field here. But, when I heard of this, I had a lot of, perplexing questions within me. First thing that I would like to ask is to Sir, to Dr. Shivashankaran and to Ms. Saraswati. You talked about the advantages and disadvantages of robotic surgery in terms of the outcome and outcome. But my question is, as a person, what is your experience? How would you compare doing an open surgery and a robotic surgery? What were your difficulties or what were your advantages? And like to Saraswati, to assist us, like in an open surgery and to be a scrub nurse for the robotic surgery. That was one question that was just reeling in my mind. And the second thing to Dr. Shivashankaran is sir, how would you see the prospect of robotic surgery in India, in the future, like say, from now, 10 years from now, or, 20 years from now? Because I had this question right from in the morning, how the art of clinical examination in medicine has been replaced, or, like there is over-reliance on the technology. That is something that was just going on in my mind. And how do you see this in the future? And the third thing is, I don't know whether to ask it as a question or a fear. Are we, to Mr. Mehta, is there, like a over-reliance on artificial intelligence nowadays, and, whether there is an undermining of the human intelligence? That's a fear in me. I don't know whether to put that as a question. Okay, these are the, like concerns that I want to raise in the forum.
Thank you, Devakrubai. I'll be starting my explanations, and I'll be followed by Saraswati. And it was nice questions. Actually, a lot of people have been having these thoughts about this robotic surgery and all. So, answering your first question, how we will be looking at after 10 years, 5 to 10 years from now on in a developing country like India. Yes, a lot of robotic platforms are all coming up. It's not only the Davinci, and a lot of companies have been developing their robots, and it's going through intense research phase also. And probably in about 5 to 10 years time, there will be a lot of companies that will be giving all the robotic machines into the market, which will actually enhance the number of robotic procedures. So I would say that robotic surgery is the future of surgery in the coming decade. And answering your second question, to replace the conventional clinical examination and the role of medical as well as paramedical staff. That is essential and that is imminent. Nobody can replace it. The technologies what we are discussing will be actually helping us into achieving a better outcome for the patient's perspective. That's what we are looking at. At the end of the day, the patient should get the best and the maximum care so that they walk disease-free and they walk symptom-free. So that's what we are looking at. We are trying to incorporate the technology in along with the human touch to the patient so that they get a better health care. And yes, what are all the advantages of a robotic surgery than a conventional surgery? Yes, it's actually a way excellent question to explain, because in open surgeries, when we are dealing with the areas which are inaccessible, say for example, when we are doing any surgeries involving the human pelvis inside the hip, it is actually very, very difficult to get an access. One thing, very, very difficult to do a precise work. These things are taken care by the robot. You can actually have a good three-dimensional image right down into the pelvis, and you can do a very precise work which will help in getting a better surgical results and outcome. So and these are all the, I've tried to explain it in a very common man's language so that it is understandable for everyone. And Saraswati sister will be explaining her part.
Yes, good evening, ma'am. Thank you for the question. So as a scrub nurse, there is a much differentiation between the scrub nurse and the circulating for the open
Saraswati,
surgery.
Saraswati,
Yes,
sorry,
yes.
could you speak little louder?
Yes. Can you hear me, ma'am? Can you hear me, ma'am?
Yes.
Okay. There are much difference between the robotic surgery and the open procedures. Robotic surgery, we need to update our skills to maintain the necessary skills to provide the high quality of patient care is the need to learn the scheduling, system management, system updating management, and the education and training. For the open procedures, we have a lot of instruments and the staffs can easily pick up the surgical techniques, then move on to the scrub field. But the robotic system, we have to go for the extra mile to learn the technical views on the system. Need to handle the console and the robotic arm system, that is a calibration, and the system draping and that endoscope draping. That's also very important to maintain the sterility before, during the procedures. Then there are so many equipments inside the room, so continuously monitor all the equipments, how it's functioning. Like example, CO2 to be available and from beginning to the end of the procedure. Then the electrical supply like a dummy machine and the system functioning, all those things need to be observed. Especially for the robotic monitor, is specific things to learn. The system shows some the wordings onto the system. That is most important to learn the nurses to rectify the issues. Then another importance in the robotic procedures, during the procedures, nurses how to troubleshoot the system. For example, during the procedure, instrument locked, cannot open, cannot move the arms. So need to release the instrument from the system. Then that time we need to coordinate with the surgeon, and there is an Allen key that during my presentation I showed you. I can show you now also. Okay. This is the key number 6. There's an emergency grip release. That is the thing we need to use to release the instrument from the system. So the arm movements and the calibration, this is the instrument, the sensor to be worked well, then only the system will be function smoothly for the smooth surgery. Yes, ma'am. The other things all to be like laparoscopic procedures. These are the things we need to take note during the laparoscopic procedures. Is we need the nurses to be updated ourselves. Be a robotic nurse.
So thank you, Saraswati. I think the next question is to Sam. Already question is asked from Devakiribai.
Yes, thank you, ma'am.
So I fully agree with you, ma'am. I think that we are talking too much AI. It's a buzzword. It's the latest time of life. So once upon a life, it used to be nanotechnology, the internet of the world, whatever, IoT. It's currently AI's turn to become famous. I think intelligence was vastly rated, and yet we've learned that common sense is much better. Yet we've learned that emotional sense is much more relevant. Sensitivity is much more important than being the smartest person in the room, right? So I think sometimes you play to the strength of where you are. And I think AI will play a role in certain areas, in certain fields. But if you look at where society is focusing, how do I beat the best chess player in the world? How do I beat the best Go player in the world is not really a great use of AI systems. Where AI systems will really play is if I was in a space where I have an oxygen deficit and therefore human beings can't really spend time. If I can leverage artificial intelligence systems to kind of like manage the spaceship while humans perhaps sleep or perhaps focus their lifetime work on planet Earth and in our own backyards, we might have much better lives because we'll know where to go, we'll know what to do before we end up doing it. So I think that's the opportunity I see. I think there was another question of will we ever see robots in India? And the answer is we're seeing lots of robots. Whether we see robots that are more effective for India is the real question. And I will tell you, in the automotive industry, we're seeing that. The unionized workforces across the country were substituted by robots. Listen to what I just said. The unionized workforces across the country in those automotive companies were substituted by robots. Why? Because the decision maker did not have confidence that the cars would be made, that they wouldn't be of a certain of quality, and they couldn't be delivered to the customer because they had sometimes unions and staff that had demands that were making it more expensive per time you made a robot or a car. So the cost per car was going up, right? And that's what happened with unionized workforces around the world. It's the same with airlines. The cost per flight is going up. Why? Because a lot of airlines are run by unions. So I think decision making is common sense. If you focus on things that are expensive, they will get substituted, right? That's basic economics, right? If you look at what you will try and substitute at home, will you buy the same as expensive car? If you get a car that's half the price, you get the car that's half the price, right? The same thing next time, if you go and buy, for example, some cornflakes for your morning, and that cost of the one you like is, let's say, 400 rupees for that pack. You know, tomorrow I am not sure I want to spend 400 rupees on that pack. I will probably want to only spend 100 rupees on that pack, and that's a luxury. If I was an average person, I probably don't want to spend more than 10 rupees for a breakfast pack that might last me 10 packs, so it costs me 1 rupee per breakfast, right? So I think that's where we will see the opportunity for change. I would pay attention to two robots that we're hearing a lot about, Google Verb and the Raptor robot. I don't know if you've heard of those two. I think they will substitute Davinci. That is my personal opinion. And that also is a risk for anybody who becomes a Davinci robot nurse or a Davinci doctor or a Davinci urologist, which we have some in India today, that they are experts in the Davinci, but the Davinci will become irrelevant. Just the same way as today I have an iPhone, tomorrow I will have some other phone, and the day after that I may have another phone. Just like I once upon a time had a Nokia and a BlackBerry, and those phones are no longer relevant today.
Joy?
Thank you. Thank you so much for the answers that have been shared. Thank you, Dr. Devakirbai, for your questions. So I now ask Ms. Ranjitham, who's also seemed to be there part of the webinar. Ranjitham, can you turn on to your video and you can present your questions. Ranjitham is the Chief of Nursing at M Hospital.
Hi Ranjitham, can you unmute yourself and speak? I can see you in the audience, please.
I'm sorry. Good evening, all. Thank you, Joy. Thanks for that introduction. Really, ma'am, I thank ANEI Tamil Nadu chapter, Dr. Clara, and Thangam ma'am too for all this beautiful webinar, which has been too informative and really energizing us and motivating us too. And looking forward for this robotic. My question here is to Saraswati.
Ranjitam, you should thank Leena. You should thank Leena.
Yes, ma'am. Thank whole team, ma'am. Really, it's really too informative and really making us too much eager to know about too many things, ma'am. And it was too informative what Saraswati was really giving a beautiful throw on how nurses can beautifully handle as the circulating nurse and a floor nurse. Keeping all those pictures in sound. Only pictures we have seen now. Once we touch this, I think this Dan amused to see all this, I think. So my question is to Saraswati. Saraswati was explaining very briefly about the at theater bedside how the nurses have to handle. My question is that you were speaking about the complications. One complication is what they will be in tilted position, so head low position. My question, only one complication was shared by you, Saraswati, that is the ocular edema. My worry is that how far the infection control, the bleeding, if there is a clot during the procedure or any other breathing problem, how it will be addressed and how it will be identified. What will be the risk of nerve injury when the patient is positioned for a long time? Whether all this will be taken care by a live nurse or again it will be replaced by the robotic.
Hello, good evening.
Yes, over to yeah.
This is all we communicate with each other to maintain the positioning prior the procedure starts. So that's why we prepare all the positioning aids like a sponge and a sacral pad for prevent compression and the DVT to prevent the DVT to get the patient after surgery. So we use a the stockinette for the patients, and during the procedure we use cuff pneumatic pump. It improves the circulation for the patient. So during the procedures, if any complications arise or we found some abnormalities with the patient's moving or instrument or robotic arm instruments is moving unlikely, so we inform the surgeon who's sitting in the console. Immediately we stop the procedures, we look for it to rectify it immediately. For the ocular pressure, that one, if it is anesthetist noted that, so we immediately reposition the back to the neutral position, communicate with the surgeon, and quickly we undo the robotic arms from the patient, then neutralize the position for the patients to rectify the issues, then we continue the procedure. So that's why the scrub nurse and the circulating nurse be more alert during the procedure time. So if any single thing is we found is abnormalities or unusual things, so we immediately communicate with the surgeon and the whole and all the team members to sort it out. Yes, ma'am, do you get that point? Or
yes, Saraswati, how frequently the position and all will be addressed?
So it depends upon the procedure. For example, robotic prostatectomy. So in the beginning, we position the patient how the surgeon prefers. Depends upon the surgeon's preference, individual preference is the positioning and the port insertion and the arms to be tucked at the patient's sides and the leg positioning, the robot arm, how they want to position into the patient during the procedure. So these all we have a preference list, then we follow that to prevent all the consequences. Yes. And for the
thank you,
arms,
Saraswati.
and for the arms, we use the foam pads to prevent the nerve injury. And we have the gel pads also. We use the gel pads, and for the shoulder supports and from the back of the shoulder, we use the gel pads to prevent from the pressure source and the scapular injuries. Yes. Yes, ma'am. Thank you so much.
Oh, that's
Thank
great.
you so much,
Thank
Ranjana.
you.
Yeah, wonderful questions from infection point of control. And thanks for bringing up this question. And thanks for your wonderful explanation, Saraswati. A very quick question to you, Saraswati. How long have you been taking training under this robotic nursing banner?
As an operating theater nurse, our robot system was there when I joined that time. So after I familiarized with the theater environment, and slowly I move on to the robotic system. I request my superiors, then I move on to the robotic system to learn. Previously, I have experience with the laparoscopic procedures, so it's a bit easy for me to learn and adapt in that situation.
Right. So I assume we'll need lots more of preceptors and buddies to help our nurses get themselves trained with the robots. A few more questions that have come from the participants across here. A couple of those have already been covered by Dr. Shiva. How can nurses, get along with robots in assisting literal patient care for assessment and things like this? We need to use more of the robots when we want to do an assessment, which is nursing. And the patient care and robots, do they go hand in hand? And how much of training do you think is actually required? How do you think now, if this is the future for us, and if the robots are right here, like what Sam was sharing with us, the automotive industry has already moved into a large portion with the robots. We don't see it very far for healthcare. Even for the COVID phase, I think many hospitals have gone in with robots doing the scanning and screening for them. That was, of course, yes, a very basic model. But then if we are looking at the future with nurses and robots, could the floor, the leaders right here, the subject matter experts, would you be able to give us like a time frame? Now this is how many sessions or hours that the nurse would learn to interact with the robot, and how long would she actually require?
It is a good question. Actually, those who are well trained in the laparoscopic procedures.
Can you be a little loud, Saraswati? We're not able to hear you.
Okay. Those who are handled with.
Oh, sir, Saras.
Can you hear me?
Yes. Yes, Saraswati.
Hello, can you hear me, ma'am?
Yes, Saraswati. Please speak to us.
Okay. Those who are learned experience with the laparoscopic procedures, much easier for them to learn and handle with the robotic instruments and the robotic system. Robotic system everyone needs to learn is a new for the those who are entered into the robotic procedure or robotic theater. First of all, the person who enters into the robotic theater or those who learn go and see the system, how they are functioning in the theater with the system and the instruments, like an observer. Then we observe for 1 week. Then we familiarize with the instruments and the equipments. Then we move on to the circulating port joint with the main circulator. So we are subordinate to them. Then we learn from them how to calibrate the system, how to assemble the arm, and how to grip the instrument arm and the camera head and the telescope. There is a much difference between the laparoscopic light cable and robotic light cable. So that is the fine-tuning things we have to learn. That's where we are need to update ourselves in the IT. So it's all in the computerized, combined with the console and the robotic arm and the instruments. So actually, it's a console system actually like as a brain for the robotic system. So it made up of the silicon chips. So we all learn some bit of things from the system itself that's easy to function in the robotic theater. Then after you learn the instrument and the equipments, slowly move on to the scrub side. Same like a substitute. The main scrub nurse will be there, then learn from them all the drapings. Then slowly move on to the instrument, how to slot into the system and how to lock it. And the telescope is very heavy, is very fragile, need to take a very careful handling during the procedures. So that one also how to lock in to the patient and the system. Then after learn this one, then we coordinate with the surgeon. Surgeon will prompt you, announce you or instruct you to change of instruments, suctioning, pause the needles, social needles inside the cavity. So at that time, the circulating nurse also must coordinate with the scrub nurse to counting the needles and the swabs. It's most important point we take note. That's how we learn the procedures. After learn everything, the manual. So I mean, the robotic nurse manager will be there to observe the new candidate, go into the procedures for each and every step, follow up. Then at the end of the procedures, then highlight to the particular staff. Then the next case to be rectified, what the lack in the first part. So that's how we learn and get experience with this robot system. Actually, it's very interesting system.
Thank you. Thank you. Thanks a lot, Saraswati. And that's the reason why I think the webinar is prolonging, and most of the participants are still glued to the webinar because it's really interesting. And the way forward is definitely having more mentors. And thanks to the lot of people who have been part of this big webinar. Thank you, Sandhya. Thank you, Dr. Devakirubai. Thank you, EC members. Thank you, Ranjidam. Thank you, Thangam ma'am. Thanks to the entire group that's been here, Dr. Shiva, Saraswati, Elaine. You've done an amazing job.
One more point to tell you. Is it okay? So regarding the infection, the sister asked I didn't really get into it. Actually, to preventing the infection, so first thing we need to maintain the room temperature because there's so many instruments inside the theater. It's all connected to the electric system, so it's warm. So maintain the room temperature to prevent the infection, number one. And then number two, during the draping of robotic arms, we have to more vigilant to keep in the sterile field safely. And the third one is the instrument prior to the surgery. We thoroughly check all the instruments, any rust formation, any particles there, or something like a laparoscopic instruments. These are the points to prevent infection to the patients. So we always take note of this one.
Yeah, thank you, Saraswati.
Joy. We have Captain Sandhya with us, who's ANEI EC member. I think she was not in the beginning, and after that she has come in. Probably she should come and then wish the Tamil Nadu nursing webinar team and the participants. Sandhya, would you please come on screen just for 1
second?
Less than a minute. We are closing and wrapping up.
We want you. We want to see. We want to see you, ma'am.
She was there a while ago. I'm not sure if she's there. Let me just check. Okay. Before we wrap up, there are two questions for Dr. Shiva. Dr. Shiva, are you there?
Yes, madam, I'm there.
Okay. From the participants in the chat box, so I'm just going to wrap up both. One is that can the cost of robotic surgery be mentioned in the background of laparoscopic surgery? And there was another one that when patients have comorbidities like cardiac, diabetes or whatever, is it safer for them to have robotic surgery? And to that, I will add just one more thing that I know you're a urology robotic surgeon, but just mention what are the other specialties where robotic surgery is catching up. Because I know there are many areas in the body which is very hard to reach, and robotics have made it much more safer. Neurosurgery, for example. So maybe you can throw a little bit light on that. Just 3 questions. Thank you.
Yes, madam. Yes. Yeah. Coming to the cost-wise part, I would say it would cost around 50% more than a laparoscopic procedure. I would stick on to that because I'm not aware how the laparoscopic procedure charges all around the country. It's somewhat like it is 50% more. It covers all the disposables and the instrument count and all those things. The second one, to answer your question, is patients with comorbidities, can they undergo robotic surgery safely? It is the comorbidities and the risk assessment for any surgeries, it holds the same for the robotics also. It's not that people with extreme comorbid conditions cannot undergo robotic surgery. It is definitely doable, provided all the patients will be subjected to general anesthesia. So as long as the patient is fit for a general anesthesia, they can undergo a laparoscopic as well as a robotic procedure in the same risk assessment. And the third question is, what was that about, madam?
All
What are
specialties.
specialties where robotic surgery is catching up, you know?
Yeah, it was predominantly mainly associated with urology when it was all starting up, but later on gastrosurgery, general surgery, and gynecology have all picked up. So
Organ retrieval, transplantation.
that is the latest one, madam. That is the latest one that is coming up. It's all a part of organ retrieval and organ retrieval and transplant. It all the part of the specialties, like gastro takes care of the liver transplant and pancreas transplant, and kidney. The urology takes care of kidney transplant. So it's an extension of these specialties. So it's mainly used in urology, general as well as gastrosurgery, and also in gynec surgeries. And there are specialized robots that is being used in neurosurgical procedures also. So almost all the specialties have their equal shares in robotics. I think that's going to be the future, be it Davinci or any other competitive technologies that is coming up in the future.
Thank you.
Thank you.
So we have come to the end of the program. Thank you very much, each and every one of you. We'll be having a formal vote of thanks, and then we will conclude. Prior to this, any conferences or any such learning platform, if we are going to close without take-home message, then that is not going to be giving us outcome. So what is Tamil Nadu ANEI members, what we have decided is, with the permission of EC members and the president and the office bearers, we would like to prepare a curriculum for a residential one-year program, and probably it can be suggested to Indian Nursing Council. So we'll work on this, and then we will put forth through ANEI, under the ANEI banner, it will go to INC. So this is a take-home assignment for all of us as leaders seated here. And for the participants, please take home messages is like whether you are having aptitude to learn this skill and move on in your professional career. Do you have an opportunity that is very in proximity with you? Think about it, and then you can proceed. And any doubts, probably you can feel free to connect with ANEI. ANEI has got a website. You can connect with ANEI website, put in your questions, communicate to us through ANEI website. So that will be the best platform where we all interact. Thank you all.
I just want to say one thing. Today morning, somebody, when we were talking about ANEI, somebody asked me, I will not tell the name, some ANEI, they said, oh, that ANEI ma'am is doing this webinars. So I said, sorry, this is not a ma'am, this is Association of Nurse Executives India. So whoever is here now remaining, just understand whenever we mentioned ANEI, it was not referring to any individual, it is Association of Nurse Executives India. You should not start calling up some ANEI and saying, ma'am, we heard your name there. That will be a problem. So that is our association. So all of us are here. So reach out to us.
Thank you so much. Thank you very much for this lighter note of ending. Thank you, ma'am. I call upon Dhanalakshmi, who is our, member again of ANEI. Kindly come on and please give the final vote of thanks.
Yes, ma'am. So gratitude is one of the least articulate of the emotions, especially when it is deep. Good evening, everyone. On behalf of Association of Nurse Executives India, Tamil Nadu chapter, and the entire organization team, it is my privilege, I, Ms. Dhanalakshmi, member of ANEI, take the opportunity to put my gratitude into words. First of all, I would like to thank Almighty God for making today's webinar a great success. On behalf of ANEI, I would like to extend my heartiest thanks to our Honorable Chief Guest, Ms. Elaine NG, Group Head of Nursing, IHH Healthcare, Berhad, for her presence in this webinar. Thank you, ma'am, for enlightening us with your inspiring and motivating words. You are an exemplary person and we have a lot to learn from you. We must have here the quote like human versus robot. 3 times a brain defeated a machine in terms of 3 C's: communication, critical thinking, and the unstructured problem solving, creativity. Though it is right, but in today's session, 3 times our speakers defeated our brain. Yes, we were overwhelmed with the knowledge of artificial intelligence, basics of robotics by excellent talk by Dr. Sivashankaran. Sir, really your input is amazing and mind-blowing, sir. Further, we are grateful to Ms. Saraswati, Robotic Surgery Nurse, Mount Elizabeth Hospital, Singapore, for demonstrating and articulating viewpoint of her to this current topic. Great to hear your experience and presentation on robotics, ma'am. I must mention our deep sense of appreciation for Dr. Sam Mehta, Vice Chairman, Dr. Mehta Hospitals, for his explanation on this topic. The presentation was practical oriented, marvelous and awesome, sir. Sir, your presentation was a macro view of micro presentation. Thank you very much for sharing knowledge. Robotics and other combination will make the world pretty fantastic compared with today. This is a common quote was given by Bill Gates. Equivalently, the following members were involved to make this webinar successful. A webinar like this cannot happen overnight. The wheels start rolling weeks ago. It requires planning and a bird's eye for details. We have been fortunate enough to be backed by a team of very motivated and dedicated members of ANEI who know their job and are result-oriented. Let me fast. Be stubborn on the long-term vision, but flexible on the details. A person who adheres this quote, silent hard worker, but achieve greater outcome. She is supporting one of the pillar of ANEI. She is a national president of ANEI, who is none other than Ms. Tangam Gomez. Thank you, ma'am, for your support and involvement to make this webinar successful. The success of the panel rests on the shoulders of the moderator. This quote are very much apt for Dr. Jyoti Clara, National Vice President and President of ANEI, Tamil Nadu Chapter. Thank you, ma'am, for your exemplary guidance, monitoring, constant encouragement, understanding, care, and empathy. Next, let me thank a person who is kind-hearted, helping nature, Secretary of ANEI, Tamil Nadu Chapter, Ms. Leena Chandrasekharan. Ma'am, your contribution to make this webinar exemplary. A special thanks to Ms. Joy Kesia, member of ANEI, for being our master of ceremonies in this webinar. I appreciate you and a wonderful job in this. Finally, many thanks to the executive members of ANEI and members of Tamil Nadu Chapter. And we also would like to acknowledge our gratitude to Ms. Haina, Ranjidam, Irene, Devakribai for your special contribution to make this webinar successful. On behalf of ANEI, last but not the least, we would like to make a special note of thanks to all the participants for their enthusiastic participation in this webinar. We believe this panel discussion provides a platform to the participant to enrich and flourish the knowledge about artificial intelligence, robotics, and nursing. Before I could conclude, I would like to share take-home message. According to Rodney Brooks, artificial intelligence is a tool, not a threat. Our future success is directly proportional to our ability to understand, to adapt, integrate new technology into our work. This was told by Sugandh Ratnakar. So with this message, I am thanking once again each and everyone who helped directly or indirectly for successful conduction of this virtual webinar. Thank you all. Take precautions and stay safe. Have a pleasant evening.
Yeah, may I conclude vote of thanks by thanking Dhanlakshmi for having drafted a wonderful vote of thanks. And I also thank Lata for deputing her on her behalf because she's on some other assignment. So thank you very much. And we have Sandhya for the last note and closing. Thank you, Sam, for your presence. Thank you, Dr. Shiva, for being spending time for nursing. So I think we will continue to stay on and let us do the homework of creating a curriculum for Indian Nursing Council. Over to Sandhya and we will close.
My pleasure.
Captain Sandhya. Shiva.
Yeah, she's there. Sandhya, can you
Thank you so much, ma'am. Thank you so much for giving me this opportunity to enter in the nurses.
Hello, am I audible?
Yes.
Hello, ma'am. I'm sorry, here.
Sandhya, yours is the last closing note. Thank you for coming in.
Hello, ma'am.
Thank you so much for actually including me here. I actually feel proud, very proud. The topic itself from the beginning, and I took all the confidence and pride to share it in my entire network. And with all the confidence, I could actually influence people. And I was happy to see a lot of familiar names who had managed to log in. And yes, there we'll say that people like us who always reach late had kept on waiting outside because we were required to be admitted. One of the very unique topics, artificial intelligence, robotics, nursing. This is something which could be instrumental in nursing empowerment. An amazing talk by Dr. Shiva, Miss Elaine, Miss Saras, Miss Jyoti, and I heard everybody. I heard the queries which were taken, and Joy moderated them beautifully. The vote of thanks by Dhanalakshmi. It is actually so influencing, so inspiring. And what I would leave everybody with, while you log off from here, go with this thought that you have acquired an unique learning information, unique knowledge information today, which is upcoming in nursing in today's era. Robotics, although it has actually developed leaps and bounds, but in nursing, it is still evolving. It is in its nascent stage. Probably we are the people who would be bringing it to the juvenile stage and to the adulthood. But before that, it is something very important for all of us to remember. Individually, we all might be very strong, but together we are powerful. We need to help each other, and we should be doing it. And probably that's the reason we all are here. Annie is here, who has got these stalwarts from the industry and from the nursing fraternity to hold hands to take everybody forward so that we all grow together. And that's what we say, together we are powerful. And I leave you with this message: stay united, keep smiling, and drink a lot of water. Nurses don't drink water, and this is one campaign past 1 year I'm promoting it every platform. Please drink water, adequate water. Thank you very much, Ma'am Thangam, Ms. Jyoti. Super excited and super grateful to be here. Thank you, everybody, and God bless you.
Thank you all. So we have come to end of the program. We are signing off, and you all go and have a wonderful evening, and think about what you could take home and what you can use for your career progression. Stay connected. ANEI is always there for all of you. Thank you all. Thank you, organizing.
Thank you so much, ma'am.
My beloved organizing team, please come on the stage.
Thank you.
Show your faces for a group photo.
Thank you, ma'am. Thank you so much.
Please come on screen for a group photo, please. Sankam.
And here I already sent message to everyone to come on the video. Okay. So when they are requested, they will not come. When they are not requested, they are on the video. Then I have to shut them off. So come. Put your videos on and let's take a screenshot and then we go home. Okay.
Yeah, ma'am.
Joy.
Yes, ma'am.
Dina.
Present.
Yes, ma'am. Present, ma'am.
Yes, Dr. Shiva, Saraswati.
One screen can only take so much. Whoever comes on video, they'll come on the first screen. So go ahead. We still have 109 people waiting. That's the record.
Yes, ma'am. That's really.
Yeah, Neelam is also there.
That also for 2.5 hours.
Yes.
Yeah.
I'm doing a print screen.
All of you smile. Cheese.
Hi. Hello, Dr. Clara.
Hi, Josephine.
Yes, I am back.
You're not on camera, Josephine. Your head is not
Come on camera.
Yes. Hi.
Just your camera. Yeah, okay, that's better.
Dina, team, Joy, Ranjidam, Dhanalakshmi. Thank you. So the next webinar I'll be a silent observer. My team will take over. Tamil Nadu, Annie, team. Keep it for congratulations.
Congratulations.
Anna.
Thank you, ma'am.
Clara.
Can I hear Sandhya and Josephine agreeing to do the next webinar?
Oh, great.
Tangam.
Yeah.
I missed most of the webinar because I was into 10 things, even though I logged in. Hopefully, you will send me the link. Dr. Clara, you will send me the link?
Yes,
That's
yes.
the new-
And while
yeah.
Josephine is here, Josephine, I'm taking this liberty on our behalf because
somebody take
Delhi
picture
is
of
going to
Hannah?
follow the trail. Delhi is going to
somebody-
follow the trail, and we are going to rock again at Delhi NCR.
Yeah, we should.
And we'll be looking forward to your experience and learnings so that
Yes,
we make
yes.
it better
Joy,
and
please
we
take
make
a
it more
picture.
Yeah,
Hannah is
okay.
here. Hannah.
Okay.
Yes.
The lady
Oh,
behind
hi.
Project 6.
Hannah, big thanks to you.
Big thanks.
It's because
Dr.
of
Clara.
you, Ms. Jyoti, is smiling and staying connected.
Yes. Thank you. Bye-bye.
All right.
Okay. Bye-bye, everyone. And
Bye,
One minute,
everybody.
1 minute, all of you. 1 minute, all of you.
Just closing with a small song. Maybe I thought we can sing Count Your Blessings because it has been so good that the webinar was a great success. So those of you who just know the song, just join along.
1 second, Hannah, people should not join because
You should only sing.
webinar, it is very,
Others
very
cannot
bad
join.
because they don't sound together. So
Others all can mute and Hannah will sing. You can mute and sing.
Just the
Hello, ma'am.
chorus.
Thank you so much to everyone.
Yeah, just the chorus.
Thank you, Saras.
Thank you, ma'am. I'm so happy. Thank you very much.
Stay on.
All with your support and encouragement.
Yeah.
It has
Just
been-
mute and stay on.
Count
yes, ma'am.
your blessings, name them one by one. Count your blessings, see what God has done. Count your blessings, name them one by one. And it will surprise you what the Lord has done. Thank you so much.
Thank you all.
Thank you. So nice.
Thank you, Ms. Sankam.
Thank you.
Thank you, EC.
Thank you, everybody, and have a very great evening.
Somewhere, otherwise this will go on and on and on. So I'm going to end the meeting, ladies and gentlemen. See you in the next webinar. Bye-bye.
Thank you, ma'am. Thank you, ma'am.
Thank
Bye.
you,
Ma'am and Dr. Clara. Thank you.
Bye-bye.
Thank you so much. Thank you so much, ma'am. Bye-bye.